Assalamualaikum warahmatullahi wabarakatuh. Good morning. Before I begin, let me introduce myself briefly. My name is Siti Maisaroh. I am a student from Nahdlatul Ulama Surabaya University. So today I would like to present my research with the title Effect Pursed Lip Breathing, Paper Windmills, and Deep Breathing Relaxation to Decrease Respiratory Frequency in COPD Patients at Ayani Islamic Hospital, Surabaya. Chronic obstructive pulmonary disease, or COPD, is the leading cause of death in various countries. COPD is a condition that causes disruption of air movement in and out of the lungs. COPD is often called a disease of a combination of chronic obstructive bronchitis, emphysema, and asthma. According to World Health Organization, or WHO, on 2015, estimates that in 2009 until 2011, there were 8.8 million people died due to tobacco use. This incidence is also justified in developed countries. The occurrence of COPD cases correlated with age reaching 90.12% in patients over 40 years. Basic Health Research on 2017 states that the highest prevalence of COPD is in East Nusa Tenggara, as much as 20%, followed by Central Sulawesi 7%, West Sulawesi and South Sulawesi 8.7% respectively. Then, for the prevalence of COPD in Central Java, as much as 3.4% with age over 30 years based on the symptoms. In the city of Surabaya, the mortality rate that occurred in 2017 was 74%. Prevalence data obtained from the medical record of the Ayani Islamic Hospital Surabaya in 2017. From January to December, there were 483 COPD cases. Pursed lip breathing, or PLB, is a breathing exercise that is recommended to help someone control breathing. This breathing indicated because it can cause a resistance to the air coming out of the lungs, which then increases pressure on the bronchi or the main airway and further minimize the collapse of the narrower airway, which is a major problem in people with COPD. In addition to pursed lip breathing, patients can also be taught with deep breathing technique. Deep breathing exercise is a relaxation technique that is done to overcome shortness of breath by involving the diaphragm. This deep breathing technique provides benefits for COPD patients. This is caused by an increase in lung volume, which will increase airflow through a narrow airway, and increase lung expansion. According to Bari 2015, breathing exercise can reduce the frequency of breathing. Increasing alveolar can also help expel as much air as possible during the expiration. Explanation of the above theory shows that both of these interventions can be applied to overcome breathing problems, especially shortness of breath experienced by COPD patients. Researchers are interested in examining the effectiveness of pursed lip breathing and deep breathing on the decrease in the respiratory frequency of COPD patients. This research used experimental research with a quasi-experimental approach, with two groups pre-test and post-test. In this study, respondents will be given an initial test that aims to determine the result of the lung volume using a spirometry device. After the initial test, the respondent was divided into two treatment groups, namely the pursed lip breathing and deep breathing exercise groups. Based on Table 2 shows that the mean value before the pursed lip breathing intervention was 33.57 and the standard deviation was 2.643, while the mean value after The pursed breathing intervention was 23.93 and the standard deviation 2.556. Paired t-test result obtained the p-value is 0.000, which means pursed breathing is effective, again decreasing the respiratory rate in COPD patients at the Ayani Islamic Hospital in Surabaya. The pursed breathing exercise with the aim of increasing expiration make it easier for the patient to release the amount of carbon dioxide trapped in the lungs, and by regulating inspiration on a regular basis will help the patient reduce the use of respiratory muscles. So in this condition, there will be a decrease in the respiratory rate. This is because pursed breathing increases the partial pressure of oxygen in the arteries, which cause a decrease in pressure on oxygen demand in the body's metabolic process, thereby causing a decrease in shortness of breath and respiratory rate. Based on Table 3 shows that the mean value before the intervention of deep breathing is 22.71. and the standard deviation is 1.326, while the mean value of the pursed breathing intervention is 20.29, and the standard value deviation is 1.383. Paired t-test result obtained p-value is 0.000, which means that there is the effectiveness of deep breathing to decrease the frequency of breathing in COPD patients at the Ayani Islamic Hospital, Surabaya. In deep breathing intervention, the preferred movement is inspiratory muscles. In this therapy, the trained inspiratory muscle will improve good lung compliance so that it will remain a constant volume of air in the lungs. This exercise is also to improve respiratory function by breathing control that can stimulate the sympathetic nerves and then will help improve the rhythm and the frequency of breathing without disrupting parasympathies that are useful to maintain the continuity of respiratory activity continuously. Based on Table 5, unpaired t-test result shows a difference between pursed breathing and deep breathing. Pursed breathing is more effective than deep breathing can be seen from the mean value. A decrease in mean respiratory rate in the pursed breathing group is 6.34 and for deep breathing is 3.50. It means that pursed breathing was proven to be more effective in reducing respiratory rate in COPD patients compared to deep breathing. In the pursed breathing technique, the patient prioritized the gradual extension of expiration by involving the herring-brewer inflation reflex in an effort to reduce the air trap in the alveoli, and will also reduce carbon dioxide in the body, which will automatically increase the oxygen entering the alveoli, and the oxygen can be bound by hemoglobin. Deep breathing technique can also help in controlling breathing more regularly. But deep breathing relies more on inspiring breathing muscles, because in a state of inspiration muscle constriction occurs. In the condition of the client has an increased respiratory frequency, muscle fatigue will occur. This can occur a reduction in glycogen in the muscles. Deep breathing technique also cannot concentrate fully on slowing expiration, even though the use of slow expiration can be beneficial for alveolar air displacement slowly.